Welcome to the immunological mechanism of autoimmune hemolytic anemia. How does a normal immune response act to a pathogen in the body? When there is a pathogen or a foreign substance enters the human body, this initiates the body's immune system to create an immune response to get rid of the pathogen. The immune system then triggers the B lymphocytes to produce antibodies, also known as immunoglobulin, to attack the pathogens or foreign substances with the help of T lymphocytes. The CD4+ cells or T helper cells will multiply and secrete cytokines that signals the macrophages and cytotoxic T cells to the infected site. CD8+ cells, or cytotoxic T cells, will kill the pathogen/target cells through a process of programmed cell death called apoptosis, where a cell's internal organelles are destroyed and dies. However, in an AIHA patient, their immune system acts differently, whereby the immune system mistakenly identifies RBCs as a foreign substance/antigen. AIHA can be classified into primary AIHA and secondary AIHA. Primary AIHA occurs as the only disorder itself and no other known cause, whereas secondary AIHA occurs in patients who have another associated medical condition such as SLE. AIHA is then further classified into two subtypes, which is warm AIHA and cold agglutinin disease, CAD. In warm AIHA, autoantibodies IgG bind to RBCs at 37 degrees Celsius, whereas, in CAD, autoantibodies IgM bind RBCs at 32 degrees Celsius and below. Let's further look into the differences between the two autoimmune hemolytic anemia. Warm autoimmune hemolytic anemia, or WAIHA, is an autoimmune disorder characterized by the premature destruction of healthy red blood cells at the body temperature. In normal people body condition, the red blood cell have a lifespan approximately 120 days, then, the RBC will be transported to spleen to be filtered out. The cell membrane of the tagged RBCs by the autoantibodies will become destroyed and causing the cell to become spherocytes. The buildup of list and irregular RBCs in the spleen causes the spleen to become enlarged. It takes about 2 days for the bone marrow to reproduce red blood cells. Due to the hemolysis of the RBC happens so fast, the RBC in the body are decreased. The rate of production of new cells in the bone marrow can no longer compensate for their loss, so the bone marrow will keep produce the RBC. Because the bone marrow keep produce the RBC, the production of the other cell become low. Hemolysis of red blood cells can cause enlargement of the spleen. It's because the spleen can't cope with filtering the healthy and list red blood cells, it causes the spleen to become overworked and swollen. Other symptoms for WAIHA are blood clots in blood vessels, which cause pain, swelling, redness and warmth. WAIHA can also cause pulmonary embolism, which are shortness of breath, chest pain, and even coughing up blood. Cold agglutinin disease, or known as CAD, is a rare type of autoimmune hemolytic anemia in which the body's immune system mistakenly attacks and destroys its own red blood cells. In CAD, hemolysis occurs frequently at cold temperature between 3 to 4 degrees Celsius and usually between 40 to 80 years old individual. In CAD, the immune system producing autoantibodies, which is IgM antibodies, and it attacks the red blood cell, causing them to clump together or agglutinate. The general symptoms of autoimmune hemolytic anemia is fatigue, dizziness, pale skin, jaundice, shortness of breath, palpitation and dark urine. While individual with cold agglutinin disease will also experience circulatory symptoms such as painful bluish or reddish discoloration at the finger, toes, ankle, and wrist. This called as Raynaud's phenomena.